Opal Germaine Moore. So Miss Opal was a client of mine, and I wanted to bring her to the stage today so that way she can talk about her experience working with me and some of the changes that she's had in her life, in her health. And we are streaming to a bunch of different platforms today. We've got YouTube, Facebook, LinkedIn, Twitter, and then up here, I'm streaming to Instagram. So if you want to stop by and drop some comments in the chat, feel free to. I'm not really going to be taking a lot of questions today because I want it to be really about showcasing my amazing client. But feel free to stop by and show some love, show some support. And if you do have any questions, you can drop them in the chat. I'll reach out to you after the show and get in touch with you. All right. So let me bring up my amazing client. Hi there, Miss Opal. How are you?
I'm good. How are you?
Great, great. So where in this whole wide world are you joining us from?
From, I would say, little old Beaumont, but listen, nothing's little about here or anything in Texas. So, Beaumont, Texas, which is about maybe an hour and a half from Houston, for those who don't know.
And so tell everybody a little bit about you because you are very familiar with being on these internet streets and you have all these amazing businesses and you're doing amazing things. So tell the people a little bit about
Thank you, thank you, thank you. Yes, so I am a client experience coach. I help small business owners when they're ready to plan a retreat, a brunch, and they just don't know how to do it, right? Or they've done it before. They've had women come back, but they're ready to elevate, offer more, be more intentional. So I help them curate that.
And I've seen some of the events that you have done, girl. Personally, I know people that have hired you to do the events, and they're beautiful, they're amazing. And I know that you and I have talked personally about events and getting them set up, and the way, just the things that you come up with, those little small details are so important. And I have learned so much. I want to say thank you because I have learned so much from you. And now when I go to events, I look at things and I'm like, that would be not Opal approved. That is not Opal approved
I
because
know. It's hard. It's so hard. And I tell people, like, once you get into my world and I show you this world, you're going to be like, oh my gosh, that is not the standard. You're saying luxury. Nothing's luxury about this standard. You'll be a little bougie afterwards. So,
but it's okay though, right? Because it's more of an elevated standard.
correct,
Right?
correct,
Very
correct.
elevated standard. And I think it takes like a different type of eye because once you're exposed to it, it's with so many things in life, right? Once you're exposed to it, you're just like going about your business. But then once you're exposed to it, oh, it clicks and you pick up on every little thing.
This is so true. This is so
Mm.
true.
Mm-mm-mm. So, Miss Opal, we are here to talk about kind of your experience working with me, being a client of mine. And I would just like for you to kind of share how did you find me? Again, in this whole wide world, how did you find me?
Well, I had the privilege and honor of finding you and building a rapport with you, relationship with you. We were in a mastermind together. That's how I met you. We have the same coach. And just kind of watching your transformation and listen to you educate about your clients and just your knowledge. I have a healthcare background. So anytime someone starts to speak that lingo and actually sound like they know what they're talking about, I'm all in, right? So I know that you're very passionate about, like, just from interacting with you in the group setting and then seeing you online with that same passion and truly understanding and the knowledge you have about this particular field and other things that we've also had conversations about. It was an easy choice. It was like a no brainer, because that's great that everybody, there's so many people on the online space or in your community, and they they can offer, they say the same thing and give all these great results, but they have no knowledge. And I challenge the knowledge. I do. I'm
Mhm.
that person. Like, I want, okay, well, tell me the science behind this. Why? And I didn't even have to challenge you. Like, you just spit out the science behind everything you do. So I love it.
Oh, thank you. Thank you. And is that kind of Is that kind of why you decided to work with me versus somebody else? Because when I first met you in that group setting, I didn't know that you had a healthcare background and what your background was. I did not know that until we started talking more. And then you spoke about that. And I think that a lot of people in healthcare are kind of afraid to like raise their hand sometimes and say, hey, I need some help with this. Like, I'm not doing too well. And oftentimes I've talked about how healthcare people are sometimes one of the sickest people we got, sick functioning people that we have out here because we're so conditioned to take care, do, give for everybody else except for ourselves. And I think, especially when it comes to healthcare, that's a big thing that we need to change about the culture that we have around healthcare and healthcare providers and the health that we provide for ourselves.
Yes, it was definitely a deciding factor, because with anything dealing with my health in general, even from, picking internal med, or like if I had a needed to look at a specialty physician or nurse practitioner, the thing is for me is I look at the reviews. I look at, what's being said. I dig a little deeper because I am a healthcare provider, right?
Mhm,
And you're right. We're like the worst ever because we feel like we can.
mhm,
We're caregivers, right? We're natural born caregivers, so we give because we're caregivers, right? And we don't think about ourselves. Everything else falls by the wayside, right?
mhm,
So, but also, I think it's because we're very picky, right?
mhm,
Because we have the knowledge and we understand. You are a nurse. I'm a respiratory therapist. We get to see the sick of the sick. You worked in the ICUs. I've worked ICUs as well,
mhm,
and so we're a little bit picky when it comes to our healthcare. So I don't want to say I challenge my that profession, but I hold it at a higher standard, right?
mhm,
And so yes, it made it very easy for me to choose you versus someone else because I didn't I didn't excuse me, I didn't have to challenge you, right? You
mhm,
like I said before, you came with the science. Like I'm all about give me why, the why behind, and I believe you're with evidence based medicine, and so like you believe like me. Okay, let's see the evidence, right? Which some people might not know what that means, but
mhm,
we understand what that means. So yeah, it made it really easy for me. That I knew you had the knowledge for this field, and the passion behind it definitely helped.
mhm,
That you really care. It's not just getting a client. It's that you care about the individual, which makes a big difference too, right? We talk about bedside manners and all of that, and how you treat your patients, and
mhm,
the way that you treated me was personable. Even though we were in a group or whatever, I know this is your business and this is your baby, and you really care about not just the weight loss. I know everybody thinks about the weight loss, but the actual over the overall well-being of the person,
mhm,
and how they're able to function and do have these activities outside of what they are normally doing to increase activities and stuff like that. So I saw it from afar and then through conversation. So it was a no-brainer. It was easy.
yeah. So, you brought up some interesting points because you use the words like bedside manner and your personality and all of that. How have you been able to like receive that virtually? Because we've never met. We've only done, and I only do telehealth for most of my visits, unless somebody is local to the Ohio area. They're not going to see me in person. It's all going to be virtual unless you upgrade to another package where we'll be doing some type of in-person wellness experience. Other than that, the way I'll see you is virtually. And was that and you knew that. So was that something that was like kind of a deterrent for you, or did you kind of not care about that? And do you think gave you enough support, because we had virtual visits, but we also had, access via Voxer, so instant messaging all the time if you needed something. So how did that kind of shape your experience? How did you feel about that, versus maybe some other things that you had tried in the past?
Right. So, excuse me, for me, telehealth is, it's not new, right? Because, like I said, I've been in the healthcare field. It's not new. It's new to a lot of people. But for me, it's not new. It is different
Mhm,
because you're not sitting across from someone, but at the same time, how you made it easy, or like easy for me to feel comfortable, is the communication, which is big, right? And I felt like, um, doing this virtually, I had, um, how can I say this? I had access to you, right?
mhm,
If you're going to someone in person, you have access to them that day that you're with them,
mhm,
right? Or and then you have to schedule another appointment or go through the office, or that, it's not, there's no hybrid where, okay, I'm going to come sit in your office and we're going to have the discussion, and then you can message me whenever you have a question.
mhm,
Everybody's not doing that in person, right? Some people are, but everybody's not doing that. They
mhm,
don't want you to have that type of access because they want that money when you come in, right? Because they're driven. I hate to say that most of them are driven, for the financial piece versus
mhm,
actually the person,
mhm,
right? And how many people they could get in a day. So that's the other thing, is that when you go to an office, you're in there for literally maybe 15, 20 minutes because they're trying to get patients in, right?
mhm,
Because these physicians and nurse practitioners, they have to see a certain amount of patients a day just to make it financially, to pay
mhm,
their employees, to like all their overhead, right? So they have
mhm,
so many people, so they do not have that time to spend with you. Versus working with Dr. Alex, I had more than enough time. Probably really not, but I could keep you all to myself. But we have more than 30 minutes, an hour, hour and a half, depending on what's going on.
mhm,
To spend with you, which it makes me feel like, okay, like she's taking her time, she really cares. You have that ability to do that, and then the personal touch of having the access via, Boxer, to say, hey, Dr. Alex, listen, look, this is what my plate looked like. This is what I'm doing
mhm,
today. This is where I'm at. And your response time makes a big difference. So that to me, that's a huge difference. And this is why for me, virtual was easier. It was easier for me because I have a very busy life, and you were very, open to, we were able to work our schedules out so I could meet you, right? Because and like most people, most people have a Monday through Friday job, right? And they work 8 to 5, and then some of them don't have time to take off to go anywhere. So virtual is a better option, right? It's
mhm,
it's just a better option for most people, and for me. And you mentioned like, what else have I tried or whatever. Okay, so I laugh because, like, I am the person, no more, by the way, after meeting
mhm,
Dr. Alex, but I am the person that will, ooh, this look good. She lost weight on this. Let me try this. So I tried Weight Watchers. I probably tried Weight Watchers like
mhm,
twice.
mhm,
Tried Optavia. Uh,
mhm,
I did that, expensive as hell. And hey, it worked, but it was too goddamn expensive. Let's just be honest, right?
mhm.
And I didn't like all the food options. So
Yeah.
I felt like I was pigeonholed, right, into stuff that didn't taste all that great. And then I've done keto. I did Atkins back in the day. I
Mhm.
even did Noom, that little app
Yay.
thing. I did. So, and here's the thing. I feel like, and I'm not knocking any programs. I'm not being a hater, because I do feel like these programs work for certain people, but I also feel like those are like cookie cutter programs. Like you are like, but Opal is not like Dr. Alex, right?
Yeah.
I don't do the same activity as Dr. Alex. So like when you get these cookie cutters, it's kind of like, okay, for this. perfect person. This is what you're going to do, and this is the results you're going to get. Versus working with Dr. Alex, it's like, okay, it's tailored to you, Opal, and your body and what you do.
Mhm. Mhm.
Sorry, I went on a rant.
No,
Rant.
no, it's perfect. It's perfect. Yeah, because we're all different. And I was going to ask if you're comfortable kind of sharing some of the health concerns that you had that we worked on, because, that's what I take into account is what health conditions do you have? And I just don't subscribe to the thing of, well, we're going to lose 10 pounds or we're going to lose 15 pounds. Like, no, like you've got a bunch of other things. All women do, not just you, all women. We all have different things that we're going through different stages of our lives. And we've got different things that are impacting our environment. Our season of our life is a huge influencing factor about what we're able to do in the moment with our health and how it's impacting our health. And so that's where a lot of those other programs just don't really cut it. They just don't meet your needs and they aren't sustainable for a lifetime. Because that's what I'm all about is doing things for a lifestyle. I don't do just the hit it and quit it. Like I'm here
Right.
for the long term, right? Because you have to find things that are sustainable for you over the long term. You need a plan A, a plan B, a plan C, a plan D, because shit's going to happen and you have to be able to have different things that you can turn to get through those moments. Because for so many women, the yo-yo shit that we did back in the day, doing that over years and years and years, that will literally do more damage to your body than
Mm,
having high blood pressure or having type 2 diabetes or having some insulin resistance. Like just those years and just continuing, right, to do that over and over again, that does more damage to your body internally in the long term. You might get those moments where you look okay on the outside, but on the inside, you're still really sick. You're still really inflamed. You still got the high blood pressure. Your liver is still full of fat. Like your kidneys are still
right,
fucked up. Like those things internally are still wrong with you, even though on the outward, you might look good for a minute. You might look
right.
good for the summer season, but then after that, shit just goes to hell after that. So it is because I see that all the time. I see that all the time. And I want you to heal, right? Get healthy from the inside out. So I don't know if you can speak a little bit about your health issues and what you've kind of
Yeah.
been able to overcome when it comes to your health and how things have improved for you.
Yeah, the big thing was my blood pressure, which we all know when you have blood pressure issues, you do retain fluid as well, right? So the crazy thing is, I did not know how swollen I was, right?
Mhm.
I did not know. It's crazy. Because I'll be honest with you, working with Dr. Alex, I haven't lost like a crap load of weight, but
Mhm.
I look like I have, right? I look like
Yeah.
I've lost a bunch, but it was the fluid. It was the fluid. Like literally, I dropped from a 18 to a 16, right?
Mhm.
And steady going. But I mean, that's why when me and Dr. Alex first started, I said, "Hey, I'll send you the weight, but I don't like to
Mhm.
look at the scale because I don't. I
Mhm.
look at the way my clothes fit. It's a huge thing for me. It's how my clothes fit, right? I listen, as long as when I was younger, I never really had a stomach. I have a stomach now. And if that slims down, then I know I'm doing the right thing.
Mhm.
But I did not know how swollen I was. And so even Dr. Alex noticed like other pictures and how I look. She was like, oh my God, didn't lose that much, but I lost all that fluid. So the big thing for me was my blood pressure, which is a huge thing because you have strokes, you can have a bleed. It's just so much that goes into that. You can have cardiac effects. I don't want CHF. I don't want flu. I don't want those things.
Mhm.
And I don't want to be short of breath when I was walking. That was one of my concerns. And that walking long distance, it's like crap. And we had a conversation because I knew I was going to San Francisco and I knew they had hills. And we had that conversation about, I was like, oh my gosh, I could walk the hills and I'm not short of breath. What is this? So I was so excited about that. That was like a big goal for me.
Mhm.
And that's what people need to realize. It's not always about the weight, right? It's about
Mhm.
what can you do in, your activity level And so my activity level has increased. Like literally, I could jog up a hill and not be as winded like I used to be long time ago, right?
Mhm.
So that like, so for me, all that was with
Mhm.
my was blood pressure driven, and I did not realize that how much. I mean, I know that, but like it wasn't like I know that for other people, but why not me? You know that was
Mhm. Yeah.
not me. I know better. That's not. But it was me. It was me. And so that was a big concern. And I remember our conversation about she's like, hey, once this gets going, you need to really stay on top of your blood pressure because your medications are gonna change,
Right.
right? And so before we got on, and I'll go ahead and share this before we got on,
Okay.
I was telling her about my little incident this week. So my incident this week is so I always check my blood pressure before taking my medication because I do know that you need to do that. I mean, that's healthcare 101, right? Because the blood pressure medicine is to lower my blood pressure. So if my blood pressure is low, I don't need to take my blood pressure medication because I'm gonna what we call bottom out, which is it'll drop it
Mhm.
really
Yeah.
low, really
Blood
quick,
pressure. Well.
and you have all these side effects. So me being busy on a routine, not paying attention, I missed one of my steps, which is take my blood pressure prior to my medication.
Mhm.
And I've noticed that my blood pressure has been really good. Like I'm even better when I was young than when I was younger. Like when I was younger, I could count on my blood pressure being like 120 to 125, the bottom, I mean, the top
Mhm.
number and the bottom number between 80 and 85, like all the time. And as I got older and started having blood pressure issues, of course, and cardiac issues, it was elevated. So that's why I'm on blood pressure medicine. So I did not take my blood pressure before taking my medication. And I
Mhm.
know, like in the back of my head, it's like Dr. Alex is like, girl, you know better. So I took my blood pressure medicine. Then I took my blood pressure, and my blood pressure was already low. It was already like 117 over something. You know, it was low, which is lower than even when I was on my good years,
Mhm.
right? I'm like, Dr. Alex is working. So what happened? Of course, throughout the day, I bottomed out. So I was telling her, like, I'm sitting here with a handful of salt, elevating my feed, drinking a bunch of water, because I did not want to go to the hospital because I did not want them to talk about me because they know me at the hospital.
Yes.
The physicians, everybody. So healthcare providers are the worst, by the way. So, but now I know, like, I haven't taken my medication since Thursday because my blood pressure has been so low. And
Mhm.
I take my blood pressure every day and I log it on my phone so I can watch it. And like literally, since working with you, I do believe it's not the medication; it's just the changes that we've implemented that
Yeah.
has kept it's kept my blood pressure really lower. And so I
Mhm.
know now my medication is about to change, right?
Mhm.
So just from Thursday till Sunday morning, I took it this morning and it was like 125 over 89 or something like that, and
Mhm.
it's normal. But I still didn't take my blood pressure medicine because I'm like, I don't want to drop it
Too
just
low. Yeah.
right. And now me and Dr. Alex can speak to that, but that's something that she teaches is, and that's the key, right? You have all these gurus out here in the virtual world, do they teach the science behind it? And that's what I'm talking about, the science behind why you should, why you shouldn't do this. That's something that you put in your program, which
Mhm.
is very special because people don't
Mhm.
know that. You know, the layperson doesn't know that. Uh,
Mhm.
so anyway, yes. So
Yeah.
that's my big thing is blood pressure. Yes. Do I want to lose weight? Yes. But like, but I also want to feel good. I want to be able to run. I want to be active. I don't want to be pigeonholed to just sitting, you know, walk short distance. I want to be able to wear my heels and not hurt and, you know, all that, all the girly things.
Yeah, yeah. And a lot of your business is kind of based around that too, right? I think a lot of women sometimes don't want to talk about some of that stuff because they don't want people to think like, oh, I don't want people to think, I'm full of myself or, I'm superficial or all this other shit. And I'm like, no, girl, like you got a brand, like your business, like
Yes.
you represent yourself and you want to come across a certain type of way. And if your health is not in check and you walking around out of breath all the time, about to fall over, can't go up steps, can't, have the energy to get through your entire event. That's not a good look on you, honey. Ain't nobody
No,
gonna invest money in you if they feel like you're gonna drop dead the next day.
exactly. And the thing, it just shows that you're not taking care of yourself. So if you can't take care of yourself, how can you take care of the business?
Exactly. Exactly. And that's the thing, like, I teach so much behind each individual and what they have going on. And that's how I tell people, like, I've had people come to me that are wanting to take weight loss meds, right? To do the injections. That's the hot thing now. I have people and I consult with people. I do health consultations, I consult with them. But there's other people that do end up coming onto a program with me. And I don't like discriminate. I don't hate against you. Like, it's your life. And if that's what you want to do, then
Right.
that's what you want to do. However, you need to know, and I'll tell you because I'll be real with you, that's not a long-term sustainable solution for you. There's in no way are you going to be able to stay on those meds for the rest of your life.
No, no. Can I say something real quick
Yes,
about that?
absolutely. Yeah, yeah.
So I forgot to mention that. Like, so I tried the Wegovy. I tried
Mhm.
the Zanzax, you know, I tried the medications, and for me, I had a GI side effect, like
Yeah,
to the point of where, like, for a week, I could not eat. I was throwing up. Like, I had a really bad, and then one I had hives. And so here's the deal, ladies. It is great that a lot of people are losing weight on that, and I'm not knocking it either. But
yeah,
you really you have to be careful who you go to
yeah,
because they will push it and that's their program,
yeah.
right? They don't really give you the nutritional side behind it and how you should eat. And they don't really discuss the side effects. So the person I went to did discuss the side effects because, like I said,
Mhm.
I vet everybody, but
Yeah.
we tried it and I was like, hey, it's just not for me. I can't do that. And she was like, cool. Well, we'll just
Mhm.
make sure that you stay with um get she advised, she's like, you need to get someone, and of course I got with you. And but she was like, it's not for everybody, and people need to
Mhm.
realize that, right? Because it's not for everybody's body. And I will say this, and not to scare anybody, but I saw the side effects of Manjaro.
Mm.
And can I speak about that real quick?
You
Like,
should,
I
you
saw
can,
real,
whatever
like,
you want. Yeah.
so saw a patient in ICU.
Mhm.
She was about 35 years old. She was taking Manjaro, and she had she had the side effect, liver failure, kidney failure, like multi organ failure on a ventilator,
Yeah.
and
Mhm.
I think it was her kidneys became like necrotic. It like everything,
Everything.
it hit her, and so just from her working on her weight loss,
Yeah.
it literally destroyed her life, and she almost lost her life multiple times.
Yeah.
I'm curious to see how she's doing today, but
Yeah.
behind a shot, and I get it. I get it. You want to jump start. Most people say, "Well, I want to jump start. I want something to jump start me." But the thing is that that's great. Just like with
Mhm.
anything, if you don't change your lifestyle,
Mhm.
it's not going to work, or you might lose your 40 pounds and then gain 80 back.
Yeah.
So
Yeah.
anyway.
No, it's very true. And I've done a couple other live streams on those meds. And if you're watching this and you do have questions about those meds, feel free to like send me a DM or send me a
Mhm.
message. Just reach out to me with your specific questions because we've both seen it clinically, these people, what happens. And again, we're not trying to knock it. We're just trying to make you
No.
aware of the side effects because one thing I'll kind of wrap this part up because girl, I could go on and on about this.
No,
I
I'm
could go on
sorry.
and on about it. But we have to think about anytime you take a medication, even though the medication is supposed to help you. And we both come from like critical care backgrounds where medications are absolutely needed, right? To save somebody's life, to keep somebody alive in that situation. But so often, so much of healthcare has turned into take a pill for this, take a shot for this, do this, right? However, we need to understand that these things are not native to our body. They're not normal to our body. We are essentially poisoning ourselves every time we take a medication. Even though it's supposed to do something good for us, we're essentially poisoning ourselves. And we need to really think twice about what we're putting into our bodies, and then knowing I'm going to put this in my body, it's going to do something to my body, and then being able to understand how to assess that change, that impact that it's having in our body. Is it really doing what it's supposed to doing? How do I feel after I take this? What has the effect been? And there's a huge gap there in medicine right now, from providers giving people these things, and just the regular layperson not really understanding how to listen to their body, how to see the changes in your body. And many of the things that you and I worked on is just how you look, right? I would have you weigh yourself, but I always said, you know,
Right.
focus more on how you look and how you feel,
Right.
and how are your clothes fitting. Show me those videos, right? We do videos. We don't, just do those basic, right, girl? We get away from basic. Just the
Right.
photos. That's so basic. Like, let's do some video. Let's hear how you're talking about yourself and your body and how it's changing, and see how those clothes are fitting on you, and what's your activity level like, and how's your energy levels like. Those are all way better indicators of what a medication or what a drug is actually doing to your body, versus just looking at a scale. Like, that's just such an insignificant data point
Yeah.
in the big grand scheme of things. So I just want to put that out there for anybody watching this. Like, just really think twice. Again, we're not knocking medications. In certain situations you absolutely need medications, but if you desire to do things more naturally, get off of medications, decrease the amount of medications that you're on, then that's entirely possible, and it's entirely within your right to do that for yourself.
Yes, yes,
Mhm.
definitely. And I've
Mhm.
been a believer of doing that, but more so now because I'm able to see it like
Yeah.
firsthand on me,
Yeah.
right? So this has been a great journey.
Yeah. So what's kind of been like the biggest impact? Because I know you made a really great video, and actually the one video that you made, I've gotten so many comments about it, because so many women just resonate with it. But you were just yourself. You were just very real in your video. You're walking your dog and all the things. So can you kind of share, like, how has your life really changed? Like, how are you thinking differently? Because the mindset piece, we didn't even get into the mindset piece, but that's a huge part of kind of the problem with those weight loss meds, is that you see the physical change so rapidly, but your mental state is not able to evolve as fast as your body does.
Right,
That's
right.
a huge part of it. And so, yeah, your physical body's going to change, but up here, you're the same person. And the person up here is not going to be able to maintain that different body. Absolutely will not.
No, yeah. I think the thing the mindset piece is huge. It's huge because like I said, I listed everything that I've tried, right?
Hmm.
And it's not that these programs don't work. The
Hmm.
problem was me and where I was at and where, my how I thought about food, how I treated food. I treated food more on the comfort level.
Yeah.
So I use food to comfort myself when I'm depressed or when I'm down. That's like a huge thing for me. And so I started to think more so, since working with you, more so of using it to fuel my body. And also, when I have, and it's crazy, like you're not a therapist.
Yeah. I'm not a therapist, girl. This ain't therapy.
However, he understands
Yeah.
the piece of how
Mhm.
people use food to comfort, right? And so you just have to make better choices. So, like when I go to the grocery store, when I pick up things, it's more of, you know, uh, like veggies or fruits. It's not those chips or like I don't have any of that in my house, right?
Mhm.
So out of sight, out of mind, right? So if you don't have it, if you don't have the access to those comfort foods
Mhm.
readily available, you're more than likely to, if you're hungry or if you're going through, you're more than likely to pick up that fruit, or whatever. So, so for me, it was more so understanding that number one, I need to figure out a better way to deal with my depression,
Mhm,
and food was not the answer.
mhm,
And so I went to therapy, right? I have therapists. So, which was encouraged. Thank you. It's encouraged to do. But then also just I literally this is gonna sound so crazy. Like I turn my nose up at certain things that I would normally eat.
yeah,
Like think about it, driving down the road, oh, I want a quick snack. Let me go to McDonald's to get some fries. Like I turn my nose up to that. Like
mhm,
literally, I just because I know what it's gonna do to me. I know,
mhm,
like I feel so great right now. I don't feel as terrible as I felt with my high blood pressure, right? Like constantly having a headache, sluggish, can't breathe. But now, so I know if I go roll up to McDonald's or whatever and get them salty fries, that okay, I'm gonna feel like crap in a few minutes, and it's crazy because now I've been eating like this for so long now that when I eat something really salty, I immediately get a headache now. Like I
mhm,
immediately get my body
mhm,
responds differently. Like my body is like, girl, you should not have
mhm,
you should have
mhm,
done that to yourself. So I don't want to feel that way. I feel good. So I don't want to feel that way. So literally, I don't. Now, do I splurge on stuff? Yes, but I am still more conscious on like what I
mhm,
splurge on,
mhm,
right?
mhm. Yeah.
I still do the intermittent fasting, and I do have breaks in it, and that was the key. Like I think that's what she kind of sold me on the intermittent fasting because everybody's like, you got to do it like you got to stay on the schedule, and she made me see that it's okay if you have a bad day. It's not the end
Mhm,
of the world.
mhm,
So
mhm,
for me, I was the person that okay, I start over Monday. I start over Monday. It's all Monday,
mhm.
right? So that was part of the mindset work because I told her that it was like I'm going to start fresh Monday, right? So
Yeah.
what happens when you start fresh on Monday? Well, then you just trash your whole week. Just start
Mhm,
fresh the next day. It's okay. It's a new day. So the mindset piece is huge because now I know, like, say today it's Sunday. What if I have a bad day today? Oh well, I, tomorrow is a new day, so I can get back on track any day. I don't have to wait till Monday. I don't know
mhm.
why we have been programmed to think Monday is the start of every day, every week, and like that's when you should start everything on Monday.
Yeah. Yeah, it is. And that's why I challenge that concept about that because, I even with me like the way that I've my work schedule has always been and even how it is now, like I've worked like all the different shift days, nights. And as I tell people like intermittent fasting can work for everybody because you can adjust it to any type of schedule that you have, days, nights, you work on weekends only, like there I've worked 3 to 11, 7 to 3. I've done all the shifts, 12 hours, whatever.
Right.
Then you get on a double and you're there all day. Like there's ways that you can adjust it and that's what I really like about providing like the virtual services and having the immediate access because not everybody's schedule is different and we're in different time zones. That has never stopped us from getting anything accomplished, like being in
Yeah.
different time zones. So I've been able to allow you access or whoever's worked with me access no matter where they are, no matter what their schedule is. And we really just tailor it to you because I get to know you and what you have going on. And we just make it work for you. And I'm very real and very upfront with you. And I'm like, if you want to make this into a lifestyle for the long term, really take like an 80-20 is what I kind of teach like that 80-20, like 80% of the time, I want you to be on your intermittent fasting and be
Right.
on your foods and your water and your workouts and all the things. But 20% of the time is when, you go out or you go on vacation and it's actually empowers you to decide to decide and be very intentional about what you're doing and why you're
Right.
doing it, instead of just falling victim to old habits or old routines, or just, or falling victim to yourself, right? Into your brain, into your mindset. Being able to work through that and be more intentional about it. And that's what I really love about the fasting too, is that it really does empower you. It
Yes.
really gives you a lot of discipline, and it's very freeing. I think people see a lot of food and health and all that shit. They see it as very restrictive, but
Mhm.
it takes a different perspective, and it's actually very more freeing to practice and have a lifestyle like this, because it just opens you up to all the possibilities of your body that you're able to do, and your body does start to heal on its own, and your body starts to show you like, yeah, I could do this and I can do this, and it's really exciting how your body starts to change. But it don't happen overnight, right, girl? It don't happen overnight.
No, no, and that's the thing is that, that's another thing we talk about. Yeah, like it does not happen overnight, but you also
No.
have to think about you didn't put all this weight on overnight either.
Exactly.
You didn't change. You didn't make all these bad habits overnight. They were over time that you
Hmm.
created this monster. And so I realized that's another part of the mindset work is that you have to realize, listen, it's going to take time to, form good habits. It
Hmm.
is. It just, like I said, though, the bad habits didn't happen overnight. So,
Yeah. And I wanted to ask you, and only if you feel comfortable sharing this. I know that a lot of people, we have like different living situations, right? And I know a lot of women have this common situation happens to them. I know it happened to me, where you kind of end up being like with the sandwich generation, right? You end up being a caregiver, but you're also a
mhm.
parent yourself, right? I've been in that situation with my dad, having to be a caregiver to somebody, but then also being a mom to two little ones at the same time. And I know how difficult it can be. And this, because this is what I hear all the time, like, well, I'm trying to be this person and I'm trying to be this person, and I don't have any time to take care of myself. I can't do it. Um, what would you say to that? Because I'm proof that it's possible. I'll just put that out there. And if you follow me, you know. But can you talk a little bit about your, and again, whatever you feel comfortable with,
Yeah.
but kind of share that.
No, so gosh, so I wear many hats. So all our kids are grown, right? We have
Hmm.
three kids, and I hate to say kids, they're young, they're adults, with families and stuff.
Hmm.
So I have grandkids, and so we have that piece, right? And so now we're in the empty nest, but not really empty nest, because I have my mother-in-law here with us. And
Yeah.
then when when my dad was ill, I helped out a lot with my mom, caring for my dad. And so once again, I have that caregiver spirit, right? And I can't
Hmm.
turn it off, right? If you
Yeah.
need me, I'm there. I'll help you any way I can. So the thing is that you get lost in that, right? And so I've been with my husband 25 years, and we've been married 20 years. And so it when you become a caregiver to someone, you kind of lose yourself. You can.
Yeah.
I've learned because I've been through it. This is now the second time I've been through it. So I learned from my previous mistakes. But then, I learned how I let myself go. And we had a conversation about, um, how you lose yourself, you lose your identity, you start to just let yourself go because you're so focused on caring for that person.
Yeah.
You give everything to that person and you forget about, okay, I should be eating like this, or I need to get up and put clothes on. That's the simple thing, right? I need to look presentable. And you just, all that goes out the window when you totally focused on just being a caregiver. So the
Right.
thing is that when you decide you want to take on that role, right? Because some people go into it not thinking about that. You don't, if you've never been through it, you're not going to automatically think of how can this affect me. You're only concerned about how you're going to help care for that person.
Mhm.
So my advice is that you need to stop and assess how you're going to set up boundaries and also set up things to for your success throughout this, because you will lose yourself in it, right? So it
Mhm.
might be, and we had a discussion about this, getting up every morning and
Mhm.
actually putting on clothes, making your face, even if you're not going anywhere,
Mhm.
right? You still want to feel good. And it's so cliche, but if you look good, you feel good. You really
Mhm.
do. You
Mhm.
really do. You get dressed and you look cute. You're like, girl, you look cute today. Like, I
Yeah.
feel like I look cute today. So
Yeah.
I feel great. I'm not going anywhere, but I look cute
Mhm.
today.
Yeah. But
But
you're doing it for yourself, and I think that's and I'm gonna let you continue, but I just want to insert
no,
this
it's good. It's good.
that because like I was even asked this like on a podcast interview not too long ago. They were like, "So tell us what your why is," right? Like people be asking like, "What's your why?" And I was like, "Is me. It ain't nobody else. Is me." And I think we forget that so much because we're a mom, we're a wife, we're a girlfriend, boyfriend, whoever, and we forget that shit. That
Yeah.
it's for you. You look cute for you. You get up, you wash your face, you do the eyes, you do the lips for you to go like this to yourself.
Yes.
That's what
Yes.
you do. That's what you do. Okay.
Right. Well, no, that's so true. Is that it's okay to be selfish and put yourself
Hmm.
first. Like, put yourself first. Like,
Hmm.
if I would have known this crap, like
Right.
years ago, I'm not going to say my,
Exactly.
I'm not really concerned about my age, but about 20 years ago, had I kept that same energy of like,
Hmm.
and just put myself first, oh my gosh. But that's the thing, is that even though, and that's what you have to realize, even though you're a caregiver, even though you're a mom or a dad or whoever, auntie,
Hmm.
um, even though you do that, you still have to put yourself first, because you need to think about it like this. If you don't care for yourself, if you don't take care of your body, if you don't take care of your health, if you don't take care of your overall self-care, your mental health, if you don't take care of all of that, you're going to be no good to
Hmm.
anyone else, right? You won't be able to help anyone else because you're going to fall apart. It's going to
Hmm.
happen. You're gonna have a breakdown. You're gonna be in the hospital or in and out the hospital. So then, who can you care for? Who can you really help if you're not helping yourself first? It's the whole thing of like when you're flying on an airplane and
Hmm.
they tell you, please,
Yeah.
put your oxygen mask on first, or put your flotation device on first. Then you can help someone, right? You have to help
Exactly.
yourself first, because you're not gonna. I mean, if you don't put yours on first and you pass out, how can you help out?
Yeah.
Right?
Yeah.
So I'll say that. So yeah, definitely with the caregivers, it's really and truly, you need something like this. You need Dr. Alex, because it's the mindset piece, right? And how you get lost. You're not going to be able to function the way you've been functioning. Because I know how you've been functioning, because I've done it, where I give
Mhm.
my all to the person I'm caring for, or the people I'm parenting, the little people that I'm parenting. And like, it's like, who is Opal? You lose your identity, you let yourself go, you're not
Mhm.
concerned about you. You just make sure they're good, but you never
Mhm.
make sure that you're good. So,
Right. Exactly. Mm. So, what would you say to kind of wrap this up today? What would you say if somebody's watching this and they're on the fence, be like, "Oh, I don't know about some online person. I don't know about Dr. Alex." What would you say to them?
well, if you actually watch the live stream, then it was said throughout.
Mhm.
Um, it was said throughout, but the thing is that the one thing, people say that they personalize or tailor programs to you, and then it's a program that they might switch a few pieces, and call it tailored to you, where Dr. Alex really does tailor this to you, your body, your lifestyle. She thinks about everything, your complete self, not just your it's not always just your health, because of the mental piece behind it, right? The mindset piece behind it of how you think about food and activity, and like you dive in and the questions that you ask up front to get to know the person, right?
Mhm.
You get to know the person, and that's how you're able to actually tailor a program to someone. And
Mhm.
so that's the difference. That's the difference than someone who runs, you know, gosh, I was gonna say like a puppy mill, but not a puppy mill. But like just kind of
Okay.
run people through the program that's put
Yeah.
together a program that's tailored to them. They don't
Mhm.
really dive into like the personal stuff because let's just be honest, our personal life drives a lot about how we think and how we treat ourselves. So you diving into even that,
Mm.
and you have the ability to make people feel comfortable to share that.
Mhm.
That's why. That's why. If you have not watched, like fully watched this live stream, go back and watch it, and you could tell how she interacts. This is not like put on for the live stream. This is exactly who she is. I only deal with people that can be their authentic self because I don't have time for anything else because I'm too busy. So,
Yeah.
yeah. So, if you're on the fence, just go ahead and message her today.
Mhm.
Get on the program. She has a lot of good things going on.
Yeah, thank you. Thank
You're
you. Yeah,
welcome.
and I was gonna say because, you know, kind of going back to that cookie cutter thing about a lot of these programs, I really created a framework and it's called Spice. And if you could see my little logo up here, and if you hear me talking about, well, let's spice it up and let's do this, like it actually does mean something. And it actually stands for the like holistic framework that I created. We didn't even, well, we've been talking very holistically this entire time. We just haven't used the word holistic, but it's the holistic framework that I created. And so the S stands for spiritual, the P stands for physical, the I is for insight, the C is for career, and the E is for emotion. And those are all dimensions of your wellness, right? That really need to be addressed and cared for when you're wanting to address your health and address your life and your lifestyle. And we've touched on every single one of those parts during this live stream. And it's what I found through my own healing, through my own transformation when it came to my health, that I really needed to fix all those areas in my life and constantly work on them, right? Because you alive, so you got to constantly be working on stuff. And that's the
Right.
part that so many people don't think about. They just think about, I'm going to reach this number, or I'm going to reach this
Right.
dress size, and my whole life is going to be
Right.
fucking fine. Like nothing ever is going to happen. And it's like, no, like that's not how it works. It's
Right.
what can you do to maintain, to sustain through this. And that's
Right.
really why I created this program, to help give you resources and strategies around that and really teach you about yourself and empower yourself, empower you when it comes to your body and the decisions that you make going forward. And that's why I do a lot of consulting, I do a lot of educating during my programs, but we do a lot of getting to know you and what's going on in your life and what season are you in your life,
Right.
and
Right.
what do we need to do for you now, and then what do we need to do for you later? Because again, I'm not here to hit and quit it. I'm here to have a practice of
Right.
clients that I'm connected to for the long term. I just don't want to see you for like 90 days and be like, whoop, and like all your problems are solved, because that's not how it works. That's not how it works.
Right.
um,
Right. You're invested.
yeah, exactly, exactly. And you definitely saw the value of investing in yourself. And that's a whole
Mhm.
nother thing we didn't even get into in this episode. But, if you watch my videos and see my live streams, I talk about investing in yourself all the time and how it's just a different mindset. Again, going back to mindset, a different way of thinking about yourself and your body. But when it comes to your health, how we really don't budget for our wellness, we don't budget for our health. And we still deal with a middle class mindset when it comes to our self care and our health. And there's an elevated version of that. There's an elevated version of you in there, that we can
Right.
tap into. But it goes back to that, to self, and knowing that you invest in yourself. You invest in a whole lot of other things. You spend money on a whole lot of other things, but yourself and your body is the number one thing.
Yeah.
to be investing in. So, and I'm glad that you took that step and that you decided to work with me. And I've loved our relationship. And we talk all the time. We talk all the time. We got big things in the works, events and in person things that we're going to be doing. So,
Yeah.
and I really value your friendship and being able to
Me
talk with
too.
you. Yeah, absolutely, absolutely. So again, if you want to get in touch with Miss Opal, if you have questions for her, if you want to learn more about the things that she's doing in the online space and her retreats and all of her amazing things, events, definitely reach out to her. I can vouch for her. She's absolutely amazing. And if you want to get in touch with me, just send me a message. That is the easiest thing to do. I'm on all the platforms and all the places. Just reach out and send me a message and let's have a conversation, see what's going on with your health and how we can possibly work together. All right.
Right.
Any parting words,
Awesome.
Opal? Anything you want to say before we go?
Just go ahead and message her now. Thank you.
I love that. See, and we working here on a Sunday, honey. It don't matter. It don't matter. It don't matter. On a Sunday. Exactly. Exactly. All right, Opal. I'm so glad that you stopped by. Thank you for doing this interview. I really appreciate
You're
it. I'm
welcome.
so proud of you and everything that you're doing. Very proud of you. All right,
Thank
guys.
you.
And
All
we're
right.
gonna end this episode today. And like I always say, for balanced life, just add spice. We'll see you in the next episode.